I'm very into health and fitness and nutrition personally. And I think beyond that, a lot of our public policy issues, I feel like, are downstream of poor metabolic health. And to take, the talents, whatever meaningful they are, however meaningful they are, that I have, and build things that can potentially impact health outcomes is very important for me.
Hey everyone, and thanks for listening to another episode of The Chief AI Officer. Today I'm speaking with Terry Miller, who's VP of AI and Machine Learning at Omada Health. Terry, thanks so much for joining the show today.
Yeah, it's great to be with you, Ben. Thanks for having me on.
Yeah, before we start, I always love to get a little personal background. I know you started in industrial sector, and then you've shifted more recently to data science and AI and healthcare. Can you talk a little bit about your background and your career journey?
Yeah, I started in the industrial space about 20 years ago. I'd say traditional sort of equipment design, which was odd because I was a pre-med undergrad, and I'm not sure how I made my way to the industrial world, but I did. And while I was in the space, just a couple of years into it, I did a graduate degree in data science. And at the time, I was doing quite a bit of work with Toyota Manufacturing's North American engineering group. And they got wind that I was either nearing the completion of, or had finished one or the other, my graduate degree in data science, and a couple of the engineers asked if we could do a couple of skunkworks projects. We did, and it went really well. That was how I got into sort of industrial data science. And then the opportunity at Omada presented itself, and it was sort of a convergence of a lot of things, a lot of different things for me. The primary one, obviously, was the ability to build another AI team, but to do it with the opportunity to impact health outcomes. And for me, that's really important. A personal past. I'm very into health and fitness and nutrition personally. And I think beyond that, a lot of our public policy issues, I feel like, are downstream of poor metabolic health. And to take, the talents, whatever meaningful they are, however meaningful they are, that I have, and build things that can potentially impact health outcomes is very important for me.
Yeah, that's a very important space that there's a lot of attention, I think, particularly in AI and how AI can help transform personalized healthcare, as you said, like biometrics, so much stuff there. How do you see that? Like, what is the current state of the healthcare industry today, and what is its relationship and potential relationship with AI?
Yeah, that's a detailed and long conversation. I think there are two benchmarks, though, or let's say bookends, that are pretty apparent for today. One is that if you're in the AI space, you want to stay away from diagnoses. And the other is the low-hanging fruit are administrative tasks. And so I think there's a spectrum in between those that a lot of ambitious, entrepreneurs and founders find themselves. And I think those are good spots. I think eventually, I'm not saying this is Omada's strategy, but I think eventually there are companies doing it now. There are startups focused on or teasing diagnoses now. But I think eventually that AI, probably always, or at least in the near term, with a human in the loop, but I think diagnoses are on the table at some point in the near future. It's just today there's so much uncertainty around, from a policy perspective, there's so much certainty around liabilities and compliance and PHI and a lot of really important topics there that it just doesn't make sense to get into diagnoses.
Yeah, that's as you said, a very big spectrum, with something very transformative at one end and something that, while still transformative from an administrative standpoint, is maybe less directly impacting kind of the health of individuals. Generative AI, as you said, has, you said AI generally, but I think Gen AI in particular has very strong implications with, PHI, with compliance and reliability. How is Omada Health trying to incorporate Gen AI as a technology, or not?
Yeah, we are. I won't get too specific on applications. We're embracing things like context summarization, always with the, for us, what distinguishes Omada is that we have a human as the center of our care paradigm and our care protocols. So for us, AI for the foreseeable future is an augment to our human-centered care approach. What you're hinting at is how do we approach veracity and provenance in Gen AI, because hallucinations are the big concern around large language models for good reason. And we do have, whether it's RAG or whether it's eventually fine tuning and self-hosting, we do have strategies in place currently and evolving strategies, a roadmap of technological approaches to really ground the veracity and provenance of our large language model. If we surface output to a coach, or eventually if we surface output directly to a member, that's not in our plans today. But in either of those scenarios, we really want to be sure of the veracity and the provenance of the model. So again, whether it's RAG or whether it's eventually self-hosted and fine-tuning, those are both technological approaches that we're going to leverage.
Yeah, that definitely makes sense within that context. And as you said, the human in the loop here is almost that health coach, which serves as the intermediary between the information generated by the model and your end customers. Is that right?
That's correct. Yeah. I think that's not only good engineering practice today with large language models. I think it distinguishes Omada from a business, from an operating model standpoint, is that we have human-centered virtual care. And that's those two things, the synergies there are strong.
Yeah. And as you bring that type of technology into your operations, right, into your systems, what are some of you've already touched on it a little bit in terms of privacy and veracity and provenance, but are there any other big challenges that you see bringing these technology deeper into your products?
There are. I mean, I think the challenges are not unique to us. I think the challenges are applicable to anyone in the healthcare space that wants to leverage AI or leverage data science more broadly. There are HIPAA considerations or regulations that have to be adhered to. So things like PHI minimized data sets and role-based access controls for developers and engineers along the stack. A number of different HIPAA-centric requirements that we adhere to very strongly, take very seriously, and have built into our ML ops and LLM ops tooling. It has been a really robust and vibrant journey to build compliant-based tools, and we've got some really strong leaders in our company in that respect.
Yeah, and you touched on part of your reason coming to Omada was this opportunity to build your AI team. As you think about ML ops, AI, everything that you're doing to deploy AI in this space, how are you building that team out, and what are some of the core competencies that you're looking for?
I love this question. I won't get too far into the details of sort of the state of what it was when I came in. There's a lengthy data science relationship at Omada. I'm going to call it applied statistics. And we're really interested in the sort of product or the applied AI. So language, vision, obviously Gen AI is a huge part of that, but true applied AI applications. And I think one of the big paradigm shifts that I brought with me was the approach to engineering ML ops and LLM ops as an assembly line, as distinct roles and responsibilities along the stack, and harmonizing sprints and delivering production data sets as a function, and training algorithms as a function, and pushing to production / app development as a function. And a lot of things buried in those specific steps. But I think there are distinct roles along the stack that I think it's really, really hard to find one person that's good at all of those things, if it's possible at all. So I think, dividing up the functions according to like traditional data engineering and, applied ML algorithms, and sort of ML engineers that handle apps and, those sorts of things. I think we're new to the company, and we're getting our legs under us now in that respect.
Yeah, that's great. It sounds like rigor and kind of discipline as far as the compartmentalization of roles, and as you said, how you really accelerate that software development process, which will be key to bring innovations into the market, right? You've mentioned LLM ops, ML ops a lot. Are you very much building with a kind of LLM first kind of infrastructure? Are you using other systems like, whether that be symbolic logic systems or, augmented intelligence or visual thing? You're involved in health, so I'd love to understand what other tools you're using.
I'll stay general on this one, in that we are using distinct LLM tooling, and because we view the applications differently, and we want to build. Obviously, latency is a big concern with surfacing output from a large language model for a coach to use in real time, and various other applications. So the tooling is different. And this is something that I talk about a lot internally. It's not just AI or machine learning enabled content. It's the delivery of the content. And so I think that's the broader question that you're asking that I don't want to get too specific on in terms of our approach moving forward. But there are some unique ways to deliver, putting systems together, systems engineering. LLMs in a vacuum are very powerful, but it's kind of like Google. I think the real power is building agents and leveraging LLMs to do things. And the front end for that, the UX, the UI, there's a lot of spread there, variability in terms of how to deliver that. And we're really excited about some potential there. Sorry, I can't be more specific.
That's okay. I sense that there's interesting things going on that you might not be able to make public, but it sounds like you're certainly doing some exciting things. As you build out an LLM agentic, even if you're engineering systems with lots of different components, you're obviously in the healthcare space. How are you ensuring, you have the human in the loop there, you have potentially RAG-based systems. Are there other things you're doing to ensure that the tooling that you're building remains kind of unbiased when it comes to a diverse patient population, and how do you effectively cater to the needs of that population?
Yeah, so we have different approaches, and this is really important for us, and we've actually devoted time to this on the ML ops side and on the LLM ops side. I won't get too far into the details on either, really, except to say we're leveraging or evaluating the ability to use language models to evaluate the output of another language model. And I think that's a fairly well-known, at least in the small sphere of those who are engineering these systems, that's a fairly well-known or emerging technique for doing that. I think there are other things that we're doing manually, evaluating things, statistically before we push to production. So if we do causal inference or A/B testing on a feature before we push to production, we're for sure doing some statistical analyses to ensure bias. And we recently had a situation with an algorithm that we were going to push to production where we flagged it for those reasons and did some adjustments. So it's very front and center for us. And there are a number of emerging tools and technologies to monitor for that, but we're baking, from a process standpoint, we're baking that into the pre-production push.
Yeah, that's great. I guess, does that connect with, I know that you recently pledged, support for the Whitehouse supported healthcare AI Commitments Coalition. Can you tell our audience a little bit about that and your role in it?
It's a consortium of some technologically progressive healthcare systems, Duke, Sanford, and I said Samford as in Alabama, and a couple of others that are working collaboratively with a task force in the White House. We're part of it. Myself and a colleague, our compliance officer, are a part of it. And it's really, it's twofold. It's sharing of best practices on how to mitigate some of the concerns specific to HIPAA and privacy and compliance generally, while also building or leveraging the technologies of Gen AI and some of the more advanced deep learning technologies. But it's also the ability to shape policy And so I'm really excited about both. My personal opinion is that provenance and veracity are going to be going to have huge policy implications for healthcare companies. If you're surfacing output to, even if there's a human in the loop, but if you're surfacing output from a large language model to especially member facing or commercially facing, but even internally, I think you're going to see policies that stipulate that those are grounded via RAG or fine tuning. They're grounded in some sort of approved care protocol. And that's not the case now. I think we'll see quickly that will be one area where this group contributes to policy there.
Yeah, I think that's going to be an important space. Elemental cognition works in, we have some RAG solutions as well, but we typically like to push it even a bit further than that, in the sense that, yes, you can ground answers and generate things based on a certain corpus and make sure that you can cite all the evidence and all of that. But you often might want to go a step further and actually generate almost like refuting evidence for that, right? Because our queries are inherently biased as well when we're testing these systems or using these systems. So I think there's going to be a lot of interesting innovation in not just how do we ground LLMs in a set of documents or a corpora, but how do we ensure that bias on the side of the user is even mitigated by how we architect these systems. So it's going to be a very interesting space.
I think there will be a lot of room to attach the framework that you just mentioned. And I mean, you can do it today. When I talk about provenance, it's if you surface output, where from the supporting documentation or the documentation that you've either used RAG or fine-tuned on, citing the documentation that comes from. And that's probably a little onerous today. We'll get better. But I think there are a lot of innovations around that, especially in the healthcare space, that are going to be crucial.
Yeah, and how, speaking of the healthcare space and the evolution of regulation, how has your strategy evolved as the regulation is evolving? Because it's changing very quickly, and I can imagine you have an eye on it. As you said, you're collaborating with the Whitehouse initiative to shape policy in some ways. But how do you see the space changing?
Well, we're committed to, just fundamentally, we're committed to certain things. We're committed to human-centered care, and we're committed to privacy and compliance and everything that we do. So I think that's our prism, and we have a roadmap for where we want to be, at least technologically, what's possible and how we want to see the company evolve with that technology for the next 2 to 3 years. And I think there is a certain element of keeping up with the evolving regulatory landscape, but it's also, I think, that's just embedded in the way that we build and the way that we form roadmaps. So it's not a stretch. We don't have aspirations that are significantly outside of where the policy landscape is going to go. So I think there are companies that do, and some that I think are doing really, really cool stuff, but they're really far ahead of where policy is today. And I think that's maybe an uncomfortable spot to be in.
That's a risky game for investors in those companies for sure.
Yes. But the interesting part of that is big player like NVIDIA with $1 trillion+ market cap and really the face of Gen AI, they're invested in some of these really progressive healthcare companies. I don't think they're going to risk their cap position and their status if they don't feel like they've got some solid footing there. But for most companies, it's you want to make sure you're within earshot of where policy is today to avoid potential scrutiny.
Yeah, I think that's the reasonable way to go about it. We have always struggled to regulate in a way that keeps pace with the technology, and I think this is going to be a different beast entirely. And I think regulation and policy really hasn't quite fully gotten to grips of what's going on here. And, it's going to be very interesting. I know in Europe, there's, more aggressive AI legislation and regulation coming out, as is typical for Europe, right? They take a kind of stronger regulatory approach, where I think it still remains to be seen how much that impacts innovation in the space, particularly in healthcare. So it's going to be an interesting few years. Shifting a little bit away from Omada and regulation, for other people, right, that aspire to lead AI within companies and reach kind of a chief AI officer role like yourself, what advice do you give those people?
This is really, really easy and simple. Make business impact. I mean, it's really that simple. I've been in this is my third build with a company. I come from the industrial space, as you mentioned, and I learned very quickly, especially in the industrial space, if you can't attach your work to solving a business problem, that's not even good enough. But to demonstrate dollars, attaching, and this is kind of my hallmark. I talk about this at different spots or, in different circuits. The ability to attach data science inferences to dollars. And if you can demonstrate, anyone who can demonstrate a portfolio of projects that point directly to either a creative or protected revenue, business impact, like meaningful business impact. You can always tell when someone's a little liberal with the statistics. You'll quickly find yourself in positions of leadership. And I think I would focus, and honestly, you have to be technically savvy. I spend a lot of my time in the weeds on technical infrastructure and algorithms and vet metrics and that sort of stuff. You have to be technically savvy, but I think that's outside of like really senior research positions for FANG or for some of the more progressive technical companies. You have to be able to demonstrate business impact. Like you have to be able to solution and connect initiatives, AI initiatives, to the overall company goals and demonstrate how you're making an impact there. Because if you don't, and you don't do it quickly, the momentum will be lost. And so I think anyone who wants to get in leadership and data science generally, focus more on solving problems that you can point revenue to, and you'll get more runway with that than you will just being really well versed in the different technical minutia.
Yeah, I think that's very good advice. And I've heard many others in your position mention that like with any leadership role, you need business acumen to be a part of it. You have the strong technical foundation. But I think, especially in this world now where there's so much hype around AI and we're seeing so many pilots go in so many different directions, like the ability to tie it to business dollars, to value, like how does it impact the bottom line, is going to be so key to move past the POC and into full scale deployment and to actually have successes. Do you have some examples of how you tie, like you said, you used a term that is like how data science inferences to dollars? Is that what you said?
Yeah.
Yeah. How can you walk through an example of that?
Yeah, I'll use my prior company. I mean, we're doing it here too, but I'm hesitant to talk about specific initiatives. In my prior role, we built churn models, binary classifiers to predict in our global services businesses. So North America, EMEALA, and APAC, we built churn models for those various businesses. We ended up having, I think, 12 in production, where we were predicting in various prediction windows the likelihood that these contracts, we predicted at the contract level, these contracts would leave our business in the next increment of time, and it varied from business to business. And so we did our holdout or our validation sets a little unique. And what we did is we knew, based on the way we did validation before scoring or before inference time, we knew with the lists of potential at-risk contracts that we gave to the business, we knew how much churn there was in that list. And that played out over time. We validated that over and over and over again. It was a continual validation process. In fact, it performed better than our test set. And so we each contract value of the contracts that we put in the business. And we knew of those that we reached out at the end of the prediction window, how many of them we retained and how many of them we lost. And so for those that we reached out to, we could assign a dollar value to those that we retained because they would have left had we not contacted them. And we could point to significant savings, and it proved over time to be the case. But I think it's the same case with any application. if you have a baseline of a thing and then you apply data science to the thing, what's the dollar value of that improvement? And I'm interested at the inference level, but also at the overall model level. And a leader in the data science space should be comfortable talking to both.
Yeah, I love that example. And I think you're absolutely right. It's sometimes the business isn't even aware of the baseline, I feel like. So you have to identify that baseline and then you can prove the impact of your model. But it's such an important starting point, and that's a great example of a project. So thank you for sharing. As businesses are looking to integrate AI, what what for you are some of the key steps to be successful?
Clarity at the executive level, without question. I've seen a lot of projects. I've been in the space for about 10 years now. And I've seen a lot of projects that start as science projects in a division somewhere or in a business unit somewhere or on one team, but they don't have executive pull. And if a project, no matter how meaningful it is, sort of at the periphery, if it's not attached to a strategic initiative in the company, the chances of it failing are significant. And so I think step one, if a company is a greenfield space for applied data science, there has to be full buy-in from the executive team. And then the subsequent step from that is there has to be clarity around what are the big sort of ticket items that the organization wants to address over the next increment of time. It can't be 30 days or quarterly pressures because you can't get something in production to impact that quickly. The next 2 to 3 years, what are the big goals for the company? And then, build out the data science team from there. And I think the challenge also, and we talked about this a little bit earlier, I've seen this happen a lot as well. The challenge is maybe it's a consultancy thing, maybe it's the safe bet thing, but I think a lot of times greenfield spaces or leaders who want to build a data science function that don't have, and it's so new, it's not a blame game, but they don't have the knowledge to know how it works, will just find the most, the person with the most technical alphabet soup after their name that they can, in terms of the most certifications and the most code models and the most technical person. And as we talked about earlier, that's maybe not the best strategy unless that's an R&D role. The best strategy is to find someone who understands technically the mosaic required to execute at scale, but then also has the ability to connect that template to problems in the business or the strategic goals. So it's a tough needle to thread. And I think we see that all around us. And I think Gen AI is another good example of it. There are absolutely companies winning with these technologies, absolutely, but it's also really hard to get right, and it requires an executive team that's fully committed to it and really clear about the outcomes and expectations for the project over the next increment of time.
Yeah, also very, very good advice to stay successful in this business. I think we're getting close to time, so I want to get one more question in. A lot is changing in the space all the time. I think the sheer pace of it boggles most people's minds right now. What do you envision in healthcare, I guess, in particular, when it comes to AI over the next 5 years? What are some of the big things that you think are going to be happening in the space?
Here's what I hope to see happen. And I think, again, we've established the bookends, but here's what I hope to see happen. I think there's evidence that this is the direction we're headed, but I would like to see dynamic real-time care. And I think, funneling lab reports and wearables, IoT data, biometric data, health histories, steps, calories consumed, all of the things that comprise a holistic health paradigm, feeding those into a language model or an engineered system, I'll say, and then having that system give you advice on how to mitigate chronic conditions or optimize health. I'm interested in this selfishly for some reasons. Very fit and into fitness and that sort of thing. So how do I optimize the little areas that I want to optimize? But I think that in terms of managing chronic conditions or managing, behavioral health or mental health, the ability to get all of this, sort of broad, fragmented data sources together. And that's really the power of big data, deep learning, AI, Gen AI, is the ability to find, patterns in diverse data sets. So my hope is that the technology is leveraged to make meaningful real-time impact for folks managing chronic conditions, or just trying to optimize their health or their sleep. Because like I said earlier, I think a lot of things are downstream from that, from a policy and a cultural perspective, that if we can get that right, I think it's a big thing. So that's my hope.
That is a big thing, and that's a very positive vision for both AI and for healthcare. Terry, this has been a pleasure. That's all we have time for today. But if people want to follow your work, where should they go?
They should come to LinkedIn. I don't know the full address, but it's Terry Miller, and search Terry Miller and Omada Health, and you'll see how inactive I am on LinkedIn. But I promise to be better if someone wants to reach out to me there.
There you go. So inactive on LinkedIn, but if you reach out, give him a direct message if you listened to the episode and enjoyed it. Thank you for your time today. This was Terry Miller from Omada Health. Terry, thanks so much for joining.
Thanks, Ben. Awesome questions. Thanks for having me on.